Hello, QHSLab. I'm Dr. Marcos and I'm here from my desk. And today I want to talk to you about an important public health crisis, that is the opioid crisis. Do you know that the foundation of the opioid crisis, it's pain? Yeah, pain that has not been well managed. Most of the patients that end up using opioids, they're being ineffectively treated for pain using only pharmacotherapy. And many of those patients, they have consistent chronic pain of 3 months or more. So we have designed a series of resources in the health journeys called the Painless series. This is a 5-part series that helps your patients educate them and understand the nature of pain. They also, we teach them how to control better their pain and manage it, and other strategies to regain health as part of their journeys. Because remember, pain, it's not only treated in a pharmacological way, we need to use other strategies in a more holistic way. So if you want to know more about how QHSLab can help your patients with chronic pain and the tools and assessments we provide to monitor and check and track how they're doing, please don't hesitate to contact me at QHSLab. These are tools designed to empower your patient, improve outcomes, help you with your clinical decision making, and why not, generate some additional revenue for your practices. See you next time.